Hey guys, this is Sarah from the DLVC. Today we're going to be doing a Hydrafacial. So generally people come in, they have different issues with acne, overall improvement for tone and texture. It can help reduce fine lines, what have you. So basically what I like to do is just ask the patient what their concerns are. Obviously hoping that the Hydrafacial will address all those issues, and then we kind of continue on from there. So basically, you just kind of examine the skin, make sure that they don't have any makeup on, and then we'll get started. So the first part of the Hydrafacial is called lymphatic drainage. Basically, what that's used for is to reduce the toxins in your body. So you generally have that at a lower setting. You usually start at the top of the head and then go down to the actual lymph nodes. You just watch the skin color, making sure that the actual section is reacting well to the skin. Lymphatic drainage is also great if you notice that you tend to carry a bit of water weight. And it's also great post-surgery. So if you've had something like vasor liposuction, which is something we offer here, or if you go and get a Brazilian butt lift, which seems to be the fad nowadays, lymphatic drainage is great to reduce that edema and just remove any of the chemicals or toxins that are used during the procedure itself. So we're just going to help her get some of those impurities, chemicals, toxins out of the body. And give her just a beautiful glow. Now your lymph nodes are located behind the ears and in the neck. So generally anytime you're doing lymphatic drainage, you'll start from the top and then work your way down.
And how does that feel to get a lymphatic drainage massage?
It's very soothing. I was just going to say that before you asked, that this is really relaxing. It's like a very mild suction.
Perfect. So next we're going to exfoliate. So we use something called Active 4. We apply that, and generally how I do is I'll do one section at a time. And then we use long, fast overlapping strokes to aggressively exfoliate. And I like to really rub it into the skin, making sure that it's penetrating all those layers. Next, we're going to do an acid peel. So we use a glycol peel.
What's the benefit of a glycolic acid peel?
Well, basically it just helps overall tone and texture, helps with that dry skin. It's going to continue to help exfoliate that naturally. So you may experience some tingling, maybe some mild heat. And I'll keep that on for a few minutes, but you just let me know if it gets to be too intense.
Okay.
And it just smells wonderful. All right, so we'll let that sit on for about a minute, and then we'll neutralize it. What's nice about a lot of the chemicals we use is they actually neutralize with water. So if you were to get something in your eye per se, you don't really have to worry about like that burn.
That's nice.
Yeah.
So are these procedures something that can be used on other parts of the body, like your chest?
Absolutely. Absolutely. Anywhere there's skin. Doing okay?
Mm-hmm.
Wonderful.
How's that chemical peel feeling?
Right now, this feels like very faintly tingly.
Good.
Very, very mild. And maybe getting a little bit warm,
Mm-hmm.
but not at all uncomfortable.
Good. That's exactly what you should be experiencing. All right, so now we'll neutralize it.
How often are these recommended?
You can do them as often as, if you want to do them once a month, you most certainly can, but recommended usually about at least twice a year.
Okay.
All right, so we're going to extract.
And what does the extraction do?
It's basically removing all the impurities from your pores. It helps reduce blackheads and whiteheads. A lot of times you can actually see the little fronds within here, kind of like suction them up. Luckily for Jessica, she doesn't have that problem. Maybe turn the head slightly for me. And then lastly, we put on a nice little hydrating serum to kind of give her a nice little glow. All right. And that's it.
Thank you.
You're welcome.
Great.
I'm really glad you enjoyed it.
I did.